Very good evening, friends. Meeting again in the session of Stuart Close Philosophy. And last time we have finished one of the important topic from fourth year syllabus, that is the general interpretation. The third chapter is I will not going to take now because it is schools of philosophy is not there in the fourth year syllabus. So we'll start directly with the syllabus chapter, chapter number 4, the scope of homeopathy. And again, this chapter is very, very, very important from exam point of view, as well as this chapter is very important for practice point of view. Reason behind that unless and until you know where to utilize homeopathy, what are the different horizons where you are going to produce results with homeopathy, what is the field of homeopathy, is nothing but the scope of homeopathy. And the way Stuart Close has tried to explain that is a very perfect way. He has explained which are not the fields of homeopathy first, and after explaining all of them, then whatever remains is the specific horizon, specific area field for the homeopathy. And because of which it becomes rather simple to understand. So, today we are going to start with this new chapter, the scope of homeopathy. Open your book and just see what he says, how he starts explaining about it. Chapter number 4, the scope of homeopathy. Accuracy and efficiency in homeopathic therapeutics is only possible to those who have a clearly defined idea of field in which the principle of similia is operative. So to introduce chapter, he says over there, this is too important that if you know exactly where to utilize homeopathy, then you will definitely get a very efficient results with homeopathy. Your success rate is always high if you know what to treat and what not to treat. So to start with chapter, he introduces that and then what he says. The scope of homeopathy is a subject which has received too little consideration by teachers and practitioners alike. And this is the problem. Many practitioners doesn't know what to treat and many practitioners doesn't know what not to treat. Both the things. Hazy and confused ideas prevail. As a result, we find on one hand a few sincere but misguided enthusiasts attempting the impossible and bringing ridicule upon themselves. So there is one group of physicians who, with the help of their enthusiasm, they tries homeopathy in the field where there is no scope of homeopathy, and because of which they are laughed at. Ridicules means hasyaspad, laughed at, and this happens because they don't know where to use where to use the homeopathy. And second group is exactly opposite of them. And on the other hand, the great majority ignorant of higher possibilities. They don't know there is a big scope of homeopathy. Ignorant of higher possibilities, missing their opportunities and bringing discredit upon themselves and their art by resorting to unhomeopathic measures in cases which could readily be cured by homeopathic remedies. So he explains over there that there is another group of patients are there which can be treated with homeopathy with successfully, but these people doesn't know to utilize homeopathy in such cases and they ask for going for unhomeopathic uses, and because of which homeopathy is blamed that homeopathy never cures like such diseases. So one must be very clear about the ideas, what to treat and what not to treat. And this is what he is explaining over there. So by introducing this thing to start with the chapter, then he explains further things. Haphazard cures do not justify boasting. The art of pharmacotherapeutics is in general and of homeopathy in particular is not advanced by such a work. Haphazard means the cure which has randomly happened. Patient has come for certain entity and luckily you have given remedy and it worked. That is what is called as a haphazard cure. Means you are not sure or you are not found the remedy on the basis of specific principles. You have not utilized the whole thing which we used to apply in chronic cases. And luckily, you have all of a sudden given that remedy and it works. And that's why he says that the art of pharmacotherapeutics in general and of homeopathy in particular is not advanced by such work. What we need is clean cut scientific work, work capable of being rationally explained and verified. Results attained by intelligent application of definite principle and perfected technique in a sharply delimited field. So what he is saying, if you want to produce results with homeopathy, you must know the principles properly. You must know how to apply them practically. You must know how to deal with the patient, and you must know specifically that where is the field, the specific area where to utilize these principles. If everything is clear in your mind, if you are damn sure about the thing, then it becomes rather simple and to get the results. The success of homeopathy always depends upon that. So success always depends on the mm, thing exactly where your scope of homeopathy is. If you know exactly the scope of homeopathy, then definitely you can produce such types of results. And this is what he wants to highlight over there. And then he says the therapeutic principle is known. The technique of prescribing has been developed. A large number of remedies have been prepared, but the field of action has not been clearly defined. Then there is a problem. So, what he is saying, the therapeutic principle is known. You know law of similars, law of simplex, law of minimum dose, everything. The technique of prescribing has been developed. So you know that technique, how to take case, how to do all those things. A large number of remedies have been prepared. You know many remedies from homeopathy, but you don't know where to utilize all those things. So you don't know exactly the horizon or scope of homeopathy, and then definitely you fail, because if you are applying all your efforts in such cases where there is no scope of homeopathy, for example, purely surgical cases or congenital disorders which are not curable with medicines, then if you try your level best, it fails. And this is what he wants to explain over there. In this respect, we are like an army which is wasting much good ammunition. Ammunition means lot of mm, things which are useful in the war, yuddha samugri, which is wasting much good ammunition trying to search out the hidden enemy of whose exact location it is ignorant. So he has compared it with this, that those military people or those army men, if they are utilizing their weapons without knowing where exactly the enemy is there, and because of which they are bombarding everywhere and losing their things from. I'm teaching from Stuart Close Philosophy, chapter number 4. Just have started the paragraph number 1, 2, 3, 4, 5. Fifth paragraph is going on. Stuart Close Philosophy, the genius of homeopathy. A philosophical aeroplane sent into the upper regions of the air may be able to locate the enemy exactly and enable us to train our guns directly upon him. So, what he says, if you know exactly the philosophy behind all those things, if you know the homeopathy in such a way, if you know exactly the scope, if you know all the principles, if you know the materia medica properly, and if you know the technique how to use, then definitely you're going to get the success. Otherwise, you cannot. And this is what he is explaining over there, the importance of knowing the scope of homeopathy. Homeopathy as a therapeutic method is concerned primarily only with the morbid vital processes in the living organism, which are perceptibly represented by symptoms irrespective of what caused them. Underline the whole thing. What he says, homeopathy deals with such types of disorders which are caused because of dynamic derangement of the vital force, which are representing itself through the signs and symptoms, basically the subjective symptoms more than objective symptoms. And last point which he has highlighted, irrespective of what caused them. So it doesn't matter if you know, it's well and good, but if you don't know, it doesn't matter, because your line of treatment depends upon totality of the symptoms. You're going to find it out a right remedy on the basis of totality of the symptoms. And that's what Hahnemann have said in the aphorism number 7. Your whole prescription depends upon the signs and the totality of the symptoms. It is the sole guide in the finding it out, the remedy. That's what the Hahnemann have said. And this is the scope where there is a dynamic derangement of the vital force, and which is reflected in the form of signs and symptoms. Then there is definitely a scope of homeopathy. In defining the scope of homeopathy, it is necessary first to discriminate. Discriminate means to differentiate. Veda ved janne. In defining the scope of homeopathy, it is necessary first to discriminate between disease per se as a morbid vital process and material results or the products in which morbid process ultimates. So this is too important to understand. Every disease develops first at the functional level. It reflects in the form of signs and symptoms. Specifically, the subjective symptoms more commonly because they are functional in origin. So, every disorder, whenever happens to be there, it starts expressing certain subjective symptoms. It persists for certain time of duration. If you treat them homeopathically, the patient will be cured at the same plane and there will be no further progress of the disease. But if you don't treat them with homeopathy, if they persist, if you do palliate them, if you suppress them, and it remains for longer time of duration, then the cellular and tissue changes starts appearing and converts into the pathology. Those are the products of the disease which has happened a way earlier in the dynamic plane, and these are end products. So whatever is tangible pathology or visible pathology is there, that is the end product of the disease. It is not a disease itself. And we must differentiate. Disease per se means dynamic derangement of vital force, and the products or pathology, that is the product of the end product of the disease. If you are able to differentiate this, then your scope of homeopathy is not related with the end products, but scope of homeopathy is always related with the disease per se. You are going to find it out remedy on the basis of disease per se, even though the patient comes for the pathological product. Many patients come just for the cancer. But our aim is not to treat the cancer. Our aim is to treat that human being where the disease has happened in the dynamic plane first and reflected in the cancer. So cancer is the end result of the disease process which happens at the dynamic level first, reflecting first in the form of subjective symptoms, then it has converted into objective symptoms, and then it has completely converted into the pathology. So if you want to find it out scope of homeopathy, you must differentiate between disease per se and the end products, that is pathology. Homeopathy always deals with the disease per se and not directly with the end products. With the latter means with the end products or pathology, homeopathy primarily has nothing to do. Underline this. This is not the scope, primarily scope of homeopathy. Means you can deal, but you cannot deal with the pathology. You cannot deal. You can deal with the human being. You treat that human being. Pathology either will disappear itself or pathology will remain as it is over there without causing any damage to the human health. It is concerned. So the scope of homeopathy is concerned only with disease per se. It's in its primary functional dynamical aspects. See, very important thing which he is explaining over there. Homeopathy deals with primary functional dynamical aspect. So whatever may be the dynamic derangement of vital force reflected through the signs and symptoms comes over there, then that dynamic derangement of or that dynamic disorder reflects in the form of some symptom. So patient who is having long standing headache, he was having a typical headache. It used to start in occiput, then it raised to up, then it goes to vertex, then it settles either on right eye or left eye, and it is there for years together. It used to get aggravated during new moon. It used to get aggravated during full moon, and patient used to be a very chilly patient. And this is the case. But he is not coming to the homeopathy. He was taking allopathic treatment. So he was palliated, and every time, whenever he has pain, he was labeled. He is having migraine, and he was given migrainal tablet and on not all that anti-analgesic stuff, and it was persistent for longer time of duration. So earlier they have done the scan, it found to be normal. Then again after 2 years they have done the scan, found to be normal, and this was going on. After 5 years of treating with migraine with the migrainil and all those tablets, after 5 years, another physician asked, "Now we'll do it your MRI again," and now he finds the lesion over there. So see, disease was there since 5 years in the form of subjective symptoms, but which was not treated properly with the help of homeopathic medicines. Because the dynamic derangement, unless and until you treat with homeopathy, you cannot cure. Only criteria is there, your remedy should be very perfect. If this fellow would have come to the homeopath, what remedy you would have selected? If this patient, instead of developing this pathology, within first year, he comes to you as a homeopath or homeopathic treatment, what remedy you would have given? A simple remedy. Yes, it is you are very clear, it is silicea. Where the disease, pain starts from occiput, it raises the head vertex, and then it either settles on right side or left side, and patient is absolutely chilly, and new moon and full moon aggravation is very close with the silicea. Would have selected silicea. If you would have given him silicea and cure, that patient's complaints would have completely vanished, then there was no further progress, no pathology would have happened. So end product is there because of palliation. It was not, it would have not happened if you would have given the homeopathy. This is what is he is explaining over there. You must treat the patient when disease per se is there instead of getting the end products of the disease. Disease per se, Hahnemann says, is nothing more than an alteration in the state of health of the healthy individual caused by dynamical action of external inimical forces upon the life principle of the living organism, making itself known only by the perceptible signs and symptoms, the totality of which represents and for all practical purposes constitutes the disease. So what is disease per se according to Hahnemann? So he has explained what is disease per se is nothing but the alteration in the state of health because of the healthy individual because of dynamic derangement of vital force. Question arises, what is the thing which alters the or which causes dynamic derangement of the vital force? So anyone who will going to explain that, what are the points what are the things which disturbs the dynamic or causes dynamic derangement of vital force, and why? Why there is a dynamic derangement of vital force and how it happens? Anyone who will going to answer? And what is third question is, what is the function of vital force?
But aphorism 9 is the function of vital force.
No,
It,
my question is, what is the main function of vital force? Ninth
it's any
aphorism is definition of vital force.
so it animates the material body
Hmm.
and and also harmonious function of all organs in our body.
Hmm.
It's it's a vital force, and also it when it derange it we felt uh, di- um, uh,
So main function of vital force is to preserve the health. That is the main function of vital force, is to keep the balance, correct. Second, why your vital force gets affected? Vital force gets affected because of inimical dynamic noxious agents. This is the word anyone have used. What is dynamic inimical noxious agent? First, you have to understand what is inimical. No, this is miasm is the word which we used to use, but what is inimical? Dynamic noxious inimical agent.
it may
Eh,
be anything, sir.
It,
Anything,
for example,
maybe grief, uh, um, maybe from other forces like bacteria, virus. These are also inimical forces for us.
simple word inimical is against your will. Inimical means against your will. If you are forced to do anything, it is against your will, that becomes inimical. You get disturbed. You simple question is that forget vital principle, forget vital force, forget vital energy. Things which disturbs you is inimical thing. In a simple language. So how do you get disturbed in day-to-day life? You get disturbed, someone says no, you get disturbed. You are prepared for something and what something happened, you get disturbed, again your vital force is disturbed. Some mishap happens in your life, your vital force is getting disturbed because it becomes inimical. So harmony gets disturbed because things goes against your will, that disturbs you. But immediately you, whether you get diseased, you never get diseased immediately, because function of vital force is to preserve this balance. Even though it disturbs for some time, after some hours or within a day or two, your vital force brings back it again into the line, and that's why you are maintaining your health. But sometimes that disturbance is so strong that vital force itself succumbs to it, and it doesn't have a strength to come out of it. Then there is a reflection of signs and symptoms. Basically, it happens first in the form of signs and symptoms which are subjective or functional. It remains for certain time. If that fellow is lucky enough to get the homeopathy at that time, patient will be cured permanently. But if that patient never gets homeopathy, he gets allopathy continuously for longer time of duration, then temporarily every time it gets palliated, sometimes it gets suppressed, and later on it reflects in the form of some pathology labeled as new disease. But this is not a new disease, this is the end product of the disease which has started very early. So this is the concept of disease which he is explaining, and if our concepts are very clear, then it becomes rather simple to understand the scope of homeopathy. I think it is better to stop over here. We'll meet tomorrow with the same thing. Uh, just a minute regarding today's lecture, whether it is possible or not possible. List could We'll take
Thank you, sir.
today we'll take a short remedy at 8:15. I will let you know which remedy we're going to learn, but most probably we're going to learn today's session. It is cyanothus. Cyanothus is a very important remedy. I will going to tell you regarding all details and practical aspects of cyanothus where I have used this remedy. So thank you being there, and good evening.
Thank you, sir. Have a good evening.